Are antibiotics needed in common cold? Viruses usually cause simple common colds, which include coughing, stuffy nose, and sometimes a mild fever. They almost always leave on their own within 2 weeks, and often get better within a few days. Antibiotics are usually ineffective against colds because they only fight bacteria rather than viruses. However, a cold can occasionally result in a bacterial infection. Antibiotics would be beneficial if they were able to prevent that kind of infection in that situation. Pros and cons of taking antibiotics must be carefully considered because colds almost always go away without any serious issues, and antibiotics often cause side effects. Research has indicated that using antibiotics to treat common colds is not beneficial. In studies, participants' colds persisted for about the same length of time whether or not they had taken antibiotics. However, side effects from antibiotics affect roughly 1 in 10 patients. These include nausea, diarrhea, and other gastrointestinal or intestinal issues. Other typical antibiotic side effects include rashes on the skin and vaginal thrush in women. The researchers came to the conclusion that the widespread use of antibiotics is not justified. Antibiotics ought to be contemplated as a therapeutic measure solely in cases where a bacterial infection has arisen due to the cold. However, this is extremely rare. Another good reason to use caution when using antibiotics is that overuse of them for minor illnesses can eventually cause bacteria to become resistant to the drugs. At that point, the antibiotics might not be able to treat infections that are more serious. References. Thank you. For more health tips visit www.mycitymydoctor.com.